So I'd like to welcome everybody to today's webinar, really important content, making sense of new HHS cybersecurity guidelines. Janet Reed, my friend and colleague, has spent a lot of time, as she always does. Janet is a researcher, but she has pored over the long-ordered, but only released in December, report that has been released by HHS, and the primary goal of today is to both cover what's in it and to summarize what's most important about it, including the 5 prevailing cybersecurity threats as identified by HHS and the 10 recommended steps that they have recommended to all healthcare practices. And then we will go through not only recommendations, but also a short demonstration of how some of the tools that we make available at PBSI can help you achieve. So without further ado, you know who PBSI is. There may be some of you, I guess there are, pardon me, in attendance who have not been exposed to PBSI before. So for those of you who don't know, we have been in the healthcare business for 30 years and serve hundreds of healthcare organizations in Ohio, Kentucky, and Indiana for all manner of technology services, but especially and increasingly focusing on IT security and HIPAA, not just HIPAA-related concerns, but all of the issues surrounding how does a healthcare organization stay secure and protect data for patients. So, Janet Reed, PBSI's Director of Security Compliance Services, will take over from here. And Janet, I value you as a person. I trust you completely. This is for those of you who are listening more so than for Janet. Janet is just a very knowledgeable resource in all manner of issues related to HIPAA and security. So Janet, take it away.
Thanks, Ray. Welcome, everyone. Today, we're going to discuss a new publication released in December last year from the Healthcare and Public Health Sector Coordinating Councils. This publication consists of 4 parts. There's a main document, Managing Threats and Protecting Patients, and that discusses current cybersecurity threats facing the healthcare industry. Volume 1 discusses 10 recommended cybersecurity practices for small care organizations, and Council describes a small practice as 1 to 10 providers. And today we're going to focus on Volume 1. Volume 2 contains recommendations for medium to large organizations, and also included is as a resource and templates that you can use in your practice. So who is this organization? A brief background on the publication. Health and Human Services, the HHS, put together a task force back May 2017. And the purpose of the task force was to develop guidance on cybersecurity for small providers and large hospitals. The task force was named the Healthcare and Public Health Sector Coordinating Council. A lot to get out. This council is made up of members from HHS, cybersecurity experts, healthcare professionals from public and private sectors. The document identifies current cybersecurity threats in the healthcare industry and provides cybersecurity practice recommendations. The recommendations are consistent with the NIST cybersecurity framework. This framework consists of 5 functions that constitute cybersecurity life cycle. First is identify. You record and keep track of your assets. Know the rules that govern your organization, complete a risk assessment, and then manage the risks identified. Protect. Only allow access on a need-to-know basis. Train your employees so they know how to protect you and secure your data and have policies that will protect your data. Detect. Have a continuous scanning of your network to detect anomalies and events before they catch you. Respond to what you found and have a plan to recover if the time would come. This is a busy slide, and it demonstrates how busy the hackers are at stealing our medical records. Almost daily, we hear about news of hacking attacks of medical records. This first article up here, CBS Morning News, just reported back in February, telling a patient story where their identity was stolen. The person was posing as this individual and using his medical insurance to have medical procedures performed. Cybersecurity experts say it only takes seconds to find medical records for sale on the dark web. The article gives an example of patient records that were stolen from a pediatric office back in 2014 for sale on the dark web, and they're titled USA Kids Full Z. And full Z is a dark web term, meaning records usually contain an individual's name, social security number, birth date, account numbers, and other data. And here's an example of some ads that are on the dark web. So the hacker's basically saying, somebody hacked into the hospital and here's the records and you can buy them for this set amount. Just click buy now. So it's really like an Amazon for criminals. CBS also reports that full medical records can sell for up to $1,000. Remember the Anthem insurance breach last year? It affected 78 million people, and Anthem was fined $16 million. That's the biggest in OCR's history. Hacking incidents in healthcare were up by 25%. If your practice suffers a breach, there's responsibility of lawsuit, government fines, cost of providing identity theft, monitoring, and let's not forget the lost trust of your patients. The council identified 5 cybersecurity threats that are impacting the safety of our patients in the healthcare industry. First was email phishing attacks, because they impact us by delivering malware and compromising our organization. Ransomware attacks lock down and hold our data hostage, and potential for permanent loss of patient records. Loss or theft of equipment data could result in breach of sensitive information and could lead to identity theft. Removal of data from your organization intentionally or unintentionally can lead to a breach of sensitive information, and attacks against connected medical devices affects the patient's safety, their treatment program, and their well-being. The report provides 10 recommendation best practices to reduce the impact of these threats. The publication's based off the security and privacy rules required by HIPAA. So we've already been given the rules many years ago, but finally, we've been given detailed instructions on how to comply with them. So I'm going to spend a little bit of time and dive into the 10 best practice recommendations. First is on email protection and recommended controls to enhance security. You need to avoid free email like Gmail, Yahoo, AOL. You know, those work fine for own personal email, but your practice needs additional services. Remember, the Yahoo was attacked back in 2016 and it affected 500 million users. You need to install spam and antivirus software for email, because that decreases junk email and safety to warm before clicking on links that lead to malware. Throughout the publication, you're advised to take advantage of multi-factor authentication whenever it's available. It is advised that you use an email service that allows for encryption, like a Microsoft Exchange is a good example. Do not share email accounts. Have a unique email for each user. Your office manager should not be sharing an email address with the billing manager. And educate your employees so they have an understanding of how dangerous email can be and how they need to protect your organization. So look out for suspicious emails containing words like urgent, act now, or messages that are too good to be true, because most likely they are not true. A great way to train staff about email is conducting phishing campaigns. Remember, education is not just for those employees who have company email, because most likely your employees are checking their own personal emails on your computer. PBSI offers products for phishing email campaign security training with a product known as KnowBe4. Next is endpoint protection. What are your endpoints? Your desktops, your laptop, your mobile devices, anything that's connected to your network. So we have to protect those devices so they don't lead hackers into our servers that store our data. Recommended practices would be to remove administrative accounts on employee computers. Administrative accounts should be left to office managers and your IT service provider. Make sure that all your endpoints have current antivirus installed. This is a requirement of HIPAA. Your devices must have the latest patches installed, and you're required to have a system in place to monitor for missing patches. If you have laptops that might leave the office, they are vulnerable to theft outside of your office. So you need to have encryption software turned on. A lost or stolen device that has encryption software turned on, it's exempt from breach. Keep firewalls turned on and device device, and again, use multi-factor authentication when available. The next recommendation refers to access management. So we have unique accounts set up for EHR for every employee. And so we should do the same for any software, including Windows accounts that are installed on our computers. Try to limit the use of shared or generic accounts. I know that sometimes is necessary at a front desk area, but try to limit those accounts. A HIPAA requirement is that we establish role-based access. And that means when setting up our user accounts, have specific settings for functions such as front desk, clinical staff, and providers. They need to have access for different areas. Access should be tailored to the need-to-know basis for each user. Have a termination policy that reminds you of all the access granted to an employee and therefore reminds you to terminate the access. So if you've done a risk assessment, you would know that you have to have a checkoff sheet that reminds you, this is the access I gave to this employee. Okay, now they're leaving and I've taken it all away, because you would be surprised at how often that gets forgotten. Set your computer so that they have automatic log off. Your EHR software should do the same, and use a screensaver. Have it set to require a password after a set number of minutes of non-use. So how do we protect our data? First off, we have to understand where the data resides. PBSI offers risk intelligence data breach scanning, and this scanning uncovers data that resides unprotected on computers. And you'd be very surprised at the results of these scans. So if we can find the data, so can the hackers. For just a few dollars per month, you can be assured that your employees are not saving data unknowingly on their local device. You need to use a tool like this to have a full understanding of what's being stored on your computer. If your computer is compromised, you need to know with certainty that PHI did not reside on that device. Remember the sanction policy that all employees are required to sign. So remind them of the consequences of lost or compromised data. Educate your employees about sensitive data and what exactly is considered protected health information. A detailed list is ideal to give to the employees. Use an email provider that allows for encryption, and if providers are texting, they must be using a secured encryption application, not something just that's on there in the messaging on their iPhone. Asset management is also part of your security risk assessment, as are all the items we're discussing today. Not only must assets like files and information be secured, but the devices themselves must be secured. Part of that security is to keep a recorded inventory of all your devices. You want to have a policy in place to record new and remove retired equipment. If devices are lost or stolen, you'll need the information, including the serial numbers for those devices. And as a reminder, once equipment is retired, you are required to have it wiped, cleaned, and recycled, and get a certificate from whoever recycles the equipment for you. Network management advises to restrict access following the need-to-know rule. Least amount of permissions needed to perform your job. If at all possible, keep your server in a closet or room that can be locked, and disable network ports that are not in use. Have an up-to-date firewall to protect against intrusions and threats from outside sources. Conduct vulnerability scanning to proactively identify flaws, and this is a requirement of HIPAA. The scan detects weaknesses in your computers, networks, and communication equipment, and scans for unpatched software and malware threats. I know that installing the updates always can be a hassle, excuse me, but they are very important. Security patches reduce the security flaws, and most of the time the patches are fixes for a found security flaw, and the hackers look for computers with that known security flaw that has not been patched. Routine patching of security flaws is essential to keeping you safe. Here's an example of a 5-facility mental health organization. So HHS found that they failed to appropriately safeguard patient data and had to pay a $150,000 fine because they failed to patch their system, and it resulted in a malware data breach. Incident response. So we must plan for the unexpected. Sooner or later, the unexpected will happen. Be it fire, flood, tornadoes, or man-made disasters, they can strike at any time. Two key points to incident response is creating backups and plans on how to recover. Recovering planning must be documented, and this is a HIPAA rule. When an emergency occurs, clear procedures must be in place. Identify employees who will act as a contact in the case of an incident. Describe steps to take in the event of a malware download, and then educate your employees on the plan. Excuse me. The resource and template section of this publication actually has a template that you can download, and it's a fill in the blank, so you can fill in with your company information and then tailor it to your practice. And it also includes a training handout for the employees, so definitely take a look at that. And you also have to have a method to keep updated with information about cybersecurity. So sign up for some email subscriptions to news outlets, and my favorites are Healthcare IT News, HIPAA Journal, and OCR News Releases. And medical devices come with their own set of cybersecurity challenges. The recommendation for medical device security is to follow the recommended practice that we've already discussed so far. Endpoint protection, identity and access management, asset management, network management, vulnerability scanning, and security operations and incident response. And last, cybersecurity policies. And so we talk about the importance of these policies in many of our webinars. And the council pointed out that the following policies should be added to your HIPAA and security manual. Roles and responsibility. So who's responsible for implementing security? You have to appoint a privacy and security officer for your office. Education and awareness. How will you train your users and how often? You're required to train annually and have periodic reminders. Acceptable use for emails. So if your employees have a company email, what's permitted and what's not permitted to be in those emails, and also how they're using their own personal email. Data classification, what is PHI and what can be disclosed? I would personally write that down on a list for employees. Personal devices, so give employees expectations. If they're bringing their phones in and they're getting on your Wi-Fi, tell them what they can and what they can't not look at. Laptop, portable devices, and remote use. You need a policy on mobile device security. So if someone's taking their laptop home and they have it sitting on the seat of their car, don't stop at the store and leave that in plain sight. Incident reporting and checklist, what's an incident and who do I report that to? Your employees are your greatest asset and unfortunately the prime vectors for attackers, so educate the employees and this will enable them to defend your enterprise. Without appropriate guidance, your greatest asset might become your greatest liability. Follow the bylaws of HIPAA or suffer major consequences. We always think that the large hospitals get the malware attacks. The truth is the attacks are only the ones that get the publicity. Go to OCR Wall of Shame. You'll see the little guys are there too. So this article shows that OCR has zero mercy on HIPAA offenders. It states that HHS cracking down on HIPAA violators, and there's just about zero mercy shed on any practice, large or small. This practice has 5 doctors, and they are paying a $100,000 fine. HHS is demonstrating that they have zero tolerance regarding HIPAA violations because HHS discovered that the employees were grossly misinformed when it came to knowing the rules and regulations of HIPAA. And they showed little effort on their policies to protect patient information. Other conduct errors included failing to obtain business associate agreements and no risk analysis. So comply with the changes in rules of HIPAA no matter the size of the practice. How do you get this publication? You go to hhs.gov and search for cybersecurity practices for the health industry. And at the end of the presentation, we'll send you an email with a link to that slide presentation. And I'm going to turn that over to Ray.
Janet, thank you very much. Appreciate the information. And I will now go into a short demonstration of some tools that we've made available to assist in compliance. So I hope everybody knows, those of you who know PBSI well know, we don't try and frighten people. We're not trying to sell services per se with a presentation like this. We are in a place where having lots and lots of healthcare expertise and IT focus, we understand that there are realities and people need to know about them. Our goal is to make simple the process of securing your risks. So an organization to really serve a healthcare practice, and the smaller the practice, the more important this is, needs to have technical competence, absolutely, but needs to have healthcare specific knowledge. That I cite a Janet Reed, who also provides information to other staff at PBSI as she learns, we learn. And to me, almost the most important thing is the folks who are overseeing your technology need to do so with an understanding of HIPAA and an understanding of healthcare specific requirements. So some things I'm going to quickly go through. So here are the 10 areas in which HHS is recommending security, which most of these are not new. This is not new information. One thing, though, that I did note is have a practice domain. We have lots of clients who have Gmail addresses or Yahoo addresses for practice staff, and that's not, it's not a HIPAA violation to do so, but it is not nearly secure, and it's really easy and inexpensive to have a practice domain. Today, acquiring a practice domain, and many practices have a domain, mypracticename.org, but still use a Yahoo or other email address to move all of your email addresses to Office 365, which is hosted by Microsoft in the cloud and using Microsoft Outlook, including the email and including 2 required, in my opinion, subscriptions that really impact security, one of which is called Advanced Threat Protection, part of Office 365. I'm going to quickly demonstrate that. And the other is a feature that permits encryption. Total cost for an email address and Advanced Threat Protection and email encryption, $8 a month per email address. So this is something that if we're not providing this kind of thing for you now, let us know. It's really easy to set up, and it's becoming more recommended as a primary security practice. Okay, so appropriate email that has the ability to encrypt. And the Advanced Threat Protection, by the way, which I'll demonstrate, that purpose is if a click is made by mistake on a link or attachment, until this Advanced Threat Protection came around, all we really had defending us, for most all of us, was the training of our staff not to click. Well, now this Advanced Threat Protection turns that click, sending the click through a secure site in Microsoft's cloud, and before it ever reaches your inbox, it sees that there's something bad about this, and instead of delivering ransomware or malware, the person who clicked on that email receives a simple message that says, that's a malicious website. That was a malicious attachment, and no damage is done. So simple and inexpensive and very, very important, which is why I mention it so prominently. So endpoint protection, this is the basic blocking and tackling that is unchanged. You must have current antivirus, you must keep your security patches up to date, and you must have automatic vulnerability scanning and alert reporting. That's the PBSI's online security monitoring does this. And those of you, many of you who are already covered by this, you're well protected in that respect. So other things that you may not know, that having PBSI's dashboard overseeing your electronic devices, we automatically maintain and capture and retain an electronic inventory of all of your assets, your PCs, your servers, and other things connected to your network. I'll do a short demonstration, some of you have seen this, of an optional add-on, which we absolutely recommend at least once. You may not want to do this ongoing, but have a risk intelligence scan done. That electronically finds every piece of unprotected, meaning unencrypted, PHI or PII anywhere on your network. So office managers, PCs, anybody who's handling payroll, there's information, social security numbers, dates of birth, information about patients, information about staff that needs to be protected, and it's virtually impossible to find it manually. So that's pretty much the things I'm going to mention. I'm going to do a short demonstration now of a couple of these areas. So first, I'm going to start with email. So you see my real inbox in Microsoft Outlook. I intentionally sent to myself a couple of emails that are bad. So I keep this for demonstration. The email that I'm clicking on now was sent to me some months ago by our security administrator and said, here's one where you can test. And sure enough, when you click this link, I'm going to do that now. Normally it would have gone to the website, but instead it went through Microsoft's cloud using this precursor that Microsoft adds called Safe Links. And so before it ever got to the inbox, before any damage was done, Microsoft evaluated it, said this is malicious, and all I have to do is close this page and say, oops, boy, that was a mistake. Glad I didn't get malware or ransomware from that mistake. Same thing with an attachment, exactly same thing. I get an email, and in this case, I got a phone call from a customer saying, I'm trying to open an email that a former employee sent to me, and I'm having a hard time opening it. Can you help me? And pardon me, I mean to this out of here. And after a conversation, I said, well, wait a minute, forward that email to me, and he did. And so I just clicked on the email that he sent to me. So fortunately, he wasn't able to do this, because otherwise he would have had the results of that bad attachment that was scammed. It wasn't really from his former employee. It looked like the former employee's email address. So instead of damage, we get a message. So that's how advanced threat protection works. The so that's $2 a month. You put your email in Microsoft Cloud for $4 a month. Exchange Online, you add $2 a month for advanced threat protection, and then $2 a month for this additional feature called Azure Information Protection. And what this does, I want to send an email potentially to a patient. So I'll send it to myself, and doesn't matter what the email is or what its content is or what attachments I put with it. I'm not allowed to do this if this email contains either an attachment or text. It claims any PHI. So because I have this $2 information protection, I can simply say, I want to add permissions. I want to encrypt this, or I could encrypt plus do not forward, or make it confidential only for internal staff. And by simply doing this and pushing the send button now, when the recipient receives this email, they get a message that says, you've received an email from Ray. Click here to put in a secure password and open, and that information is never exposed on the internet. So it completely protects all traffic associated with that message and any reply that might be given to me. So that was a short demonstration of using Microsoft Office 365, actually Exchange Online, and the two security features that we recommend. Simple and inexpensive. We're encouraging all clients to move to a solution like this because it's really, really secure. Okay, moving on. What you see on your screen is PBSI's security monitoring dashboard. So here on the left-hand side are the lists of all clients that PBSI monitors. I have selected just PBSI. So PBSI technicians are looking at all of the results for all clients all the time. Over on the right-hand side at the top, the most problematic device in the entire network comes up. Well, since I've selected only PBSI, only workstations at PBSI show up. But the most problematic on a rating scale of what kinds of events, and if a backup had failed, it would come right to the top of the list. If the, there are certain things that are just absolutely, if a virus occurred, it'd be right at the top of the list. So what happens when I select a device in the top panel, down in the bottom panel is displayed all of the information that's being tracked. So I'm going to go and look at my desktop PC. So I'm going to select down here at PBSI all the workstations that have the name Ray somewhere in their name. And so here is my desktop that I'm sitting in front of while I'm talking to you. I could look at my home PC that I've monitored because I log in from my home PC to the office at times. I could look at my Microsoft Surface. But in this case, I'm looking at my desktop, and what shows up down here on the bottom are all the things that are being checked. So at a broad level, the dashboard technicians are paying attention to red, yellow, green. So these things are all green, so nothing really, and here's a green mark up here. So before ever looking at this device, somebody could have known this device is probably fine. However, there may be some things individually that might need attention. So the monitoring is looking at a lot of HIPAA required things. Are patches up to date? There's a tool here that would show me if there were any failed logins. This is a requirement to track failed logins, and it's the kind of thing where Ray is never personally going to go check his PC for failed login. So somebody, in this case, it's PBSI technician staff, looking at this will let Ray know if somehow there's a security problem on Ray's PC and somebody's trying to log in. So these are things that no one wants to pay attention to themselves. Hire somebody really inexpensively to do it for you. That's pretty much what our monitoring staff does. So we know if all the software is up to date, if the hardware is working okay. We can see performance issues. There are occasions where we'll contact the client and say, is your server running slowly or is your PC running slowly because we're seeing RAM usage is at 100% or disk usage is really, really high. What's going on? Is there a problem? So we know that the advanced monitoring agent, the antivirus, is up to date. And an interesting thing, I looked at this earlier. I'm going to look at updates for antivirus. If I look at the right thing, let's see if I picked the right thing this time. Now, it tells me the frequency of updates. And when I looked at this earlier, here we go. I was really surprised to see, because I don't look at this. Look at March 7th. There have been 8 or so updates just today, and there were 10 or so yesterday. So you think, really, there are patch updates to antivirus that happen 10 times a day, every day, every day? Why might that be true? Because there are so many threats, and as threats are uncovered in Nebraska or in Sweden, they are sent through a centralized service and fixes are uploaded to individual PCs. So 10 times a day, does that tell you something? If you don't have current, well-designed active protection, what kind of activity you might be in for? Okay, so I don't want to spend too much time there, but having everything monitored so that you know the status of everything that's going on. And the same thing with patches. So patches are updated twice a week, and anything that's pending means it's already been selected. So I know that every patch of every piece of software on my PC has been installed. I know that antivirus activities, virus activities being monitored. I know that my web usage is being monitored. So this is an optional thing. Not everybody has to do this, but I would know if there's a lot of traffic or traffic that's been blocked at any particular PC. So one other thing I'm going to do, so everything I've just shown you is a part of basic online security monitoring, including patch management, vulnerability scanning, alerts, and antivirus. I'm going to now show a $3 a month feature that some percentage of our clients have. Most do not. If I have a scan run on my PC every night that looks for unprotected, meaning unencrypted PHI or PII. So I leave a little bit of data on my PC so that the scan will find something, and it's looking for, in this case, it found some what appear to be MasterCards, some social security numbers, some dates of birth. Otherwise, my PC passed PCI compliance scan, other vulnerability scan, but it found some data on my PC. What did it find? It found this list of things, some of which might be in my recycle bin. And in this case, it found an Excel file that I intentionally leave there called sample file with dummy SS numbers. And sure enough, there are what appear to be social security numbers in that Excel file. It's not encrypted, so the scan found it. So what's the point of this? Why would I care about this scan being done? I can't protect something that I don't know if it is, if it contains compromised data. So why am I protecting? Why am I looking at this information? I want to know in advance what might happen if a hacker did get a hold of my PC or server or any other device in our office. What could they compromise? Because if that day comes and we have that hack, that disaster that bypassed all of our security, what did we lose? What did we compromise? How would I know that unless I knew what was already stored there on that device? And otherwise, I would be faced with, as we've seen clients come face to face with this, a hack took place. Now the question is, do we need to report a breach? What data was compromised? How do we know if something was taken? How do we know if there was data there that was could be stolen? And this is such an inexpensive and simple way. It also provides information beyond what would be expected of a HIPAA auditor. They see you're going to this level of detail, and they're going to say, okay, we know as an organization you're paying attention to doing the right thing. Okay, so we've looked at the online monitoring. We've looked at the data breach scanning, which, by the way, we scan thousands of devices among clients, And every day it finds credit cards and driver's license numbers and social security numbers. There's one thing I want to point out about this screen. So I'm taking a little change of topic for a moment. We did a webinar a couple of weeks ago on the upcoming end of life by Microsoft of Windows 7. So look at this graph. These are all the devices in PBSI's client base being monitored. And notice Windows 10, more than 50%, but notice this black area, those are Windows 7 devices. January 20th next year, Microsoft will end support. No more updates, no more support. It will become on that date the same as Windows XP was some years ago, a HIPAA violation if you continue to use it. So the reason, and if you would like a copy of the webinar, we're happy to send you a link, just ask us. But we're paying attention and contacting clients who have Windows 7 devices, making sure you know the options. An option you really don't have if you want to retain HIPAA compliance is leave them in place. You can do that at the risk of security and fines. And again, this isn't a fear tactic. I'm trying to identify here in March of 2019 that next January, these devices need to be out of place. So what are your options with Windows 7 units? One is to upgrade them to Windows 10, which usually means adding some RAM at the same time. And one is to replace the PC. And there are criteria where we can help make recommendations. And we're providing all Dell PCs and laptops at Dell website prices, so that when clients need to spend money on hardware, they know they can come to us, get the right recommendation, and not need to spend more money doing so. Okay, so this is just among the set of stuff that we see at a macro level. So that's everything I plan to demonstrate. Let me return back and let's wrap up. So the important things that you need to pay attention to, we can help with all of them, and some that don't show on a technical screen would be assistance with security risk assessments and assistance in identifying security gaps. These are things that we can help with one time, we can help with on an ongoing basis. We have a great set of policies and procedures related to all things IT, including security related items that we sell very inexpensively, and then we'll customize them for you. Janet has worked with so many practices in helping them update and put in place cyber policies that really will pass HIPAA muster, and has found, and we see all the time, people have purchased policies and procedures on the internet, but they still sit there with the same my practice name at the top. And as each policy comes about, where you have a choice, what is your policy going to be on password length, on whatever the topic is, it sits there without a policy in place, never been looked at. It's we got the standard policies, we thought that might be helpful. Well, it's really not helpful. You might as well not have them as have something that you haven't looked at, decided on, and communicate with staff. Okay, so final thought here is, in summary, there are some action steps that you may want to consider if you don't already have these in place. And most of you listening are covered by PBSI's online security monitoring, which includes antivirus protection, patch management, vulnerability scanning. We offer some free handouts to employees to make sure that employees are aware of other security recommendations, like no unapproved downloads on your PCs. For those of you who we do basic monitoring and you'd like to have us do a one-time or an ongoing risk intelligence scan, just ask us. It's easy, it's inexpensive, easy to put a quote in your hand so you know what's available. Online backup. For those of you who still have servers with physical backup where you're trading out cartridges, we're now recommending all clients go to online backup. So there's a fee associated with online backup, but there's also great additional protection. Never again would you be at the risk of you have a backup that's not been working and nobody's been paying attention because nobody's looking at the tape log that comes out of your printer every day that's been telling you that your backup's been failing and you're not aware. Well, when you do online backup, we're aware every time a backup takes place, and there's weapons grade protection built in against ransomware with right online backup. So just some simple things. Then security training. PBSI uses KnowBe4 for our own HIPAA and other security training, and it works really well. They're short video contents that are really well designed. And one of the most important things is the training that takes place with every staff person is auto-documented. So when somebody says, who got trained? You hired an employee last month, have they been trained? We have electronic documentation, and all it took was an email to them that said you need to do this, and then it's electronically monitored. Did they complete it? And so over the years in healthcare, we've just learned there are some things that are very difficult in practice to do that we've tried to make really simple. So we're finished with content. I want to thank each of you, not only for your attention today, but for your long-term support. Some of you are new to PBSI today. I hope you found this informative. That's our goal today. And if you'd like assistance, any of these areas where you're not sure if we have you covered, or you're not sure if you are covered and you want to send us an email or call us, we're happy to help identify where you might want additional assistance, including we offer a service really inexpensively. We find that the simple, stupid thing of when a PC is replaced, the requirements to make sure that the hard drive's destroyed and that the recycling is done in a HIPAA compliant manner and that you have a certificate of disposal. We take care of this for clients. So you have stuff you've taken out of commission, get in touch with us. We can help make sure it's disposed of correctly and that you have certification that it was successfully disposed of, just among the minor details. So again, thank you for your attention. We're finished. I hope everybody has a great